Hello everyone, my name is Rick Jenkins and I am the publisher at GSA Business Report. We fold up under an umbrella of business publications called SCBIZ, the media company that serves high-level business executives in South Carolina. In the Low Country, we are the Charleston Regional Business Journal. In the Midlands, the Columbia Regional Business Report. And again, here in the Upstate, we are GSA Business Report. Welcome to another episode of Coping with COVID, our ongoing coverage of our battle both at home and at work with the coronavirus. Recently, as part of this video series, I spoke with Dr. Matt Bittner with the Prisma Health system about the pandemic. Dr. Bittner supervises all emergency room physicians in the Upstate. Prisma is the largest not-for-profit health organization in South Carolina. And today, our conversation in this topic continues with another Prisma Health professional, Dr. Rachel Brown, the Medical Director of Prevention and Wellness. Dr. Brown is also a family physician and the owner of a health and wellness company called Free to Move Fitness, so she is certainly qualified to discuss this topic. Welcome, Doc.
Thank you so much for having me.
It is good to see you.
Good to see you.
You live and work in Columbia, right?
I do.
And you drove up this morning?
I did.
Well, I appreciate you doing that.
Yeah,
I know you're
course.
busy. I know you're busy, right?
Not at all.
We got a whole lot to talk about today, and a wide range of topics. But before we get into that, I want to talk about you for a second.
Okay.
You're a South Carolina girl, right?
I am.
Newberry is,
yeah.
Yes. Right?
Yes.
And you stayed in college. You went, where'd you go to your undergrad? Where'd you get
The
that?
College of Charleston.
College of
Stayed in
Charleston.
South Carolina. Then went and got a graduate degree at University of Georgia before medical school.
Which was Boston University.
Went up north for medical school.
Pretty impressive, BU, getting your med degree there.
It was interesting.
I bet it was.
It was. It was very cold. That's what I remember. It was very cold.
Yeah, a little warmer here.
Yes, I love it here.
And then you came back to the Palmetto State, and you've stayed.
Absolutely. I came back for my residency in 2000 with my husband, with whom I couples matched. He's an emergency medicine physician at Prisma.
Okay.
And the plan was to travel after that, but
that did not
Columbia
occur.
had its hooks in us, and we've been there and raising our family there and love living there.
Right. Well, good. Mm-hmm. You are the medical director of Prevention and Wellness
Yes.
at Prisma Health.
Right.
And you have a team of folks that actually provide programming, wellness programming, to not only the employees at Prisma, but the employees for business clients as well. Tell me, what does that programming look like?
Well, so what's interesting about my department is that I'm with Business Health Solutions, which is a department of Prisma Health, but it means that not only do we work with our own team members, but we work with local businesses and bring all sorts of wellness programming to them. So the kinds of things that come to mind automatically, like annual screenings, flu shots, weight management programs, healthy eating programs. But there's more to it than that. We also provide episodic care and on-site clinic oversight. We are working on telehealth, as you can imagine, which was accelerated over the last few months.
Right.
And we've really started expanding our services to focus more on comprehensive well-being, including emotional well-being, building resilience, coping strategies, that sort of thing. So the full spectrum of care with coordination with primary care physicians, so that we're not the new primary care home, but we serve as an adjunct to someone's regular physician.
Right, got it. You know, you come to us today at a tough time, right?
Yes.
And I want to talk about how tough that is right now. South Carolina's a hot spot.
Yeah.
One of 9 states that is designated a hot spot in the country. And it seems like things are getting a little worse. And to provide a little bit of context, the first case of the coronavirus in South Carolina happened on March the 16th, first confirmed case, a few days after a state of emergency was called. And here we are, and we're filming this, what is this, June 25th, guys? We're filming this on June the 25th, so we are 14 weeks removed from our first case, and the curve, as they say, is not curving. It continues to go up. And yesterday, as a matter of fact, we had 1,300 confirmed cases in South Carolina, the most that we have ever had. Doctors and nurses have got a tough time right now. How are the folks at Prisma holding up?
We're doing well. We have an incredibly supportive organization, and even possibly more importantly, an incredibly supportive community. Lots of folks have rallied around us. In fact, I believe it was yesterday, the the parachuting group landed on our campus lawn to celebrate us, and so that was a lot of fun. So people are really honoring us and recognizing the kind of work that we're doing. It's tiring. It's been a long time. Everyone has been, going at full blast for a long time, and people are getting exhausted. And I think there's some frustration there. To be clear, those numbers were getting better, right?
Yes, they were.
And then they started to trend upward right about the same time as we started to re-enter society, right? Which is okay. Right. We want that to happen. But without the proper precautions, was really not unexpected. And, folks will tell us, well, we're testing more, and that's why the numbers are going up. And in part, that is true. But the more important number to look at is the percent positive of cases, and that really tells us what the disease burden is doing. And that has significantly risen.
Right.
So we've gone from somewhere around 11 to 12% positive back in May to now up to 16, 17% positive, which means more and more people are getting the disease. And so we know that's because we haven't been following precautions as well as we should have, and that's what I'm here to talk to you about today.
DHEC reports every day statistics statewide, not only statewide, but by county and by city. And if you have a chance, I would suggest that our viewers go to their website. You get tons of information there. But the info that came out of DHEC yesterday, of course, was very concerning. And I don't want to sound overly sensationalistic, but it seems a little dire to me in a way. The cases are now almost 30,000 in South Carolina since we started. Deaths are almost 700. If you do a little bit of quick math, 2.5% of the folks who contract the virus are succumbing to the virus. Are those statistics in line what you all are feeling at the health system?
We are, absolutely. And understand that in a healthcare organization, we're going to see the sicker patients as well. So it almost feels even more elevated to us. And I think that's, in part why we take this so seriously. We are scientists, we are medical professionals, we understand the data, we understand the disease course, but we also see the sort of bleaker aspect of it. And what's concerning to us is that our vulnerable population is still vulnerable. None of that has changed. So while we were feeling comfortable that our numbers were starting to trend downwards and we could begin to get back to life as normal, or as before, those folks are still at very, very high risk. And then, of course, we also see the outliers, the people who you wouldn't suspect who are at high risk, who become very, very sick. So we take this very seriously, and we hope to spread that message to our community without scaring them, but just knowing that there are ways to handle this, and we just need to follow those precautions.
That's right. Again, DHEC yesterday, the Department of Health and Environmental Control reported that yesterday was the most hospitalizations in one day that we've had since this whole thing started. I remember when this became, started trending upward, and this became such a hot topic, and we're talking again late March, early April, when every night on the news, if you all were watching, you probably saw doctors and nurses on the front line, and they were tired and they were worn out. This was 3 months ago. And now we've got more hospitalizations in one day than ever. You've already touched on it a little bit, but how are they holding up, and how do you make sure that they're not overworked?
That's a great question. Well, first of all, let's just go ahead and say that in healthcare we're all overworked. We were overworked before March.
Fair point.
I can tell you that.
Fair point.
We work very hard, and the folks that go into healthcare are highly dedicated people. And part of my job as a resilience expert is convincing them that taking care of themselves is just as important as taking care of everyone else, and we can talk about that a little later. But one thing that I can say is that we are in a very different place now than we were in March. So while, yes, the numbers are going up, and yes, we're extremely busy, we're moving from an acute crisis response to a long-term planning response, right? So we had all hoped in March, well, what do we need to do to respond to this crisis and get through this in the next couple of months until it settles down? Now we understand we need to be looking at it more as in terms of long-term solutions and standing up more sustainable initiatives. And that's also the kinds of things that I recommend to businesses too when they're thinking about how they're going to return to work.
Right.
Let's not think about this in terms of the next couple of weeks and getting everybody back on board. Actually, let's think about what you're going to be needing to do for the next few months to maybe even years for COVID or flu or anything else that we need to tend to.
Right. Let me ask you this. There's a lot of folks out there who don't want to wear a mask. There's a lot of folks who feel that they shouldn't have to wear a mask, and I'm not commenting on that one way or the other. Whether you think you should or you shouldn't, I'm asking you, Dr. Brown, why should they?
First, let me say, please wear a mask. I say that out of love for our state. I say that because as a medical professional who has spent the last few months making sure I know everything there is to know and about COVID and keep up with all of the recommendations from CDC and WHO and DHEC and others, it is one of the best ways to prevent the spread of this disease. Now, you don't see me with my mask on today, but that's because we're socially distancing, and that's the other half of that coin, right? Wearing a mask and socially distancing are by far the best ways to keep this spread under check. And it really, in my mind, is a gesture of caring and compassion.
Mm-hmm.
Because you may be protecting yourself, but more importantly, you are protecting those of our community members who are vulnerable and others, and it's just the right thing to do. Is it a pain? Of course it is. Can it get hot? Absolutely. If you don't have the right kind of mask, can it be uncomfortable? Sure, let's find you one that is comfortable. There's nothing dangerous about wearing masks. I know that some people have gotten conflicting information around that. There's nothing dangerous about that.
Right.
There are some people who do have anxiety disorders, and that makes them feel very uncomfortable. But we want to work with you. We want to make it so that you're as safe as possible and that we really do care for each other as a community by wearing those masks.
Right. You put it perfectly. Good job. So regardless if we want to or not, or if it should happen or not, people are going back to work. Is it safe to go back to work? And I understand social distancing, but is it safe for my employees to come back into the office?
It's a great question, and it's one that I get every day. I should tell you that my job role has changed since February and March, and a lot of what I do now is counsel businesses on how to reopen and answer questions exactly like these. And the answer is almost always, it depends. So for as many businesses as there are out there asking me this question, there are plans to tend to their reopening. Because it is a very particular, customizable, tailored consultation that we do through Business Health Solutions. So it depends on what your capabilities are for, say, phasing employees back into work, maybe not bringing everyone back at the same time. What are your capabilities for any kind of teleworking, working from home, virtual work, that sort of thing? What do you do at work? There's a very different approach to folks who are maybe in close proximity working on a line versus folks who work in an office, maybe even in their own cubicles. So yes, it can be safe. The recommendations will be different depending on the venue, and that's where we can help. But I can tell you that in general, there are 3 things that we recommend to everyone, if you're interested in hearing those.
I am.
The first is some sort of screening. Now, the most common method is entryway screening, and some of you may have even been places where they've taken your temperature at the door, or they've asked you questions about symptoms such as cough and fever, sore throat, loss of sense of smell and taste. But there are other ways to do that as well. There are products now out there electronically that you can check in and say, no, I'm fine, I don't have a fever, and I don't have any of these symptoms. So some sort of screening before folks even hit the door, right? While they're in the building, while they're at their venue, their work site, I don't know if I can say it enough, wearing a mask and social distancing. And sometimes that's easier said than done.
Right.
But those 3 elements will really are the foundation for making a workplace very safe.
Right. Not every office are you going to be able to social distance as much. I mean, you got small businesses here, right? And those small businesses aren't necessarily going to be able to have the things that you talked about in terms of check-ins.
Right.
So in those situations, should people stay at home as long as they possibly can and work virtually?
That's a difficult question.
It's tough,
to answer.
I'm
It
tired
is
of working
tough.
at home.
Yeah, well, let me tell you, as a medical professional, I have an answer, right?
Yeah.
Yes, let's figure this out. As a parent, I have a very different
Mm-hmm.
answer. There's only so much time you guys can all stay,
That's right.
cabin
That's
fever
right.
sets
Gotta
in
get out.
pretty quickly. As a person who contributes financially to my home, I have a different answer. People need to get back to work.
That's right.
So this is a very, very complicated question. Again, one of the things I like to do when I talk with business leaders is find out, what is your capability for working from home? What can you do in that respect? And so much more can be done from home now, but there are still things that can't be done from home. And I feel that there are ways, even if social distancing is a challenge, for instance, folks working on a line, even if wearing masks can be uncomfortable in hot areas, that sort of thing, we can figure this out for you. We can figure out a way to make it so that you can get back to business, folks can start to earn a living, but we can still be safe at the same time.
I agree. I think it's called respect for others. It's called using logic and being smart.
Right.
One of the things I miss is going to a restaurant. I haven't been to a restaurant in a long time, and I want to go to a restaurant and I want to sit down and have a nice meal. Can I do that?
Look, I'm a foodie, so I'm 100% with you, and takeout just doesn't cut it.
Right.
I'm with you. Yes and no. It depends. So you mentioned what Dr. Bittner said, and that is that we can expect somewhere between a 4 and 6 foot distance to keep us safe from each other. But there actually are other activities where those droplets can move farther, and he may have mentioned those as well. And things like yelling and singing and those kinds of things mean we need a little bit more distance. Some folks have said eating may be the same way. Now, that I think has to do with your manners more than anything else. But I will say going to a restaurant with outdoor seating is probably not going to be an issue at all, as long as, again, the tables are 6 feet apart and you're just there with people that you feel are at low risk. Not an issue at all. I myself have not been inside a restaurant yet. I have gone and eaten outside, and thankfully now that I'm back in South Carolina, that's not as hard to do.
Right, exactly. So what if one of my employees gets the virus? What do I need to do?
Yeah. So this.
I mean, excuse me, but you hear all the time about, well, this employee was here on Saturday, and they heard that person was around someone who had the virus, and now we got 3 degrees of separation.
Yeah.
Where do we say, oh, we better be careful, or where do we say, you know what, we can't protect against everything?
Yeah. And that line does this all
right.
the time, right?
Right.
So this is one of the most common questions I get. What do I do with employees who may have been exposed to an employee who has tested positive for the virus? And what I can tell you is that there actually is a definition for close contact. If you look at the CDC website and the DHEC websites, their definition of close contact is within 6 feet of each other for more than 15 minutes. It used to be 10 minutes. It's been upgraded to 15 minutes. That sounds great. That's a very concrete answer, but in real life, that's difficult to determine, right? So what we do when we get that question from businesses is we ask a lot of questions about what work life is like for that COVID positive employee. Technically, if we do not feel that there was close contact, so they wore masks, they maintained social distancing, maybe this person was in an office setting, that sort of thing. The recommendation is that employees be made aware, other employees be made aware that employee is COVID positive, and monitor for symptoms. So stay vigilant for symptoms. They do not recommend that these folks stay home from work. Okay, they don't recommend that they necessarily get tested as long as they're asymptomatic. They don't have any symptoms of COVID. But the reality is that can be very anxiety provoking, right? So while the guidelines are pretty clear, defining whether that COVID positive employee had close contact with someone can be a little gray, and we have to work on figuring that out, but then also mitigating that anxiety. And so we work with businesses to help them know who should be tested and who should not be tested, who should be sent home and not sent home,
Right.
and can tease those nuances out. But in general, if you've been practicing precautions, you do not have to send employees home who, if you have a COVID positive employee, you just ask them to monitor for symptoms.
That's interesting. It is not what I thought, quite honestly.
Right.
You mentioned anxiety. This is more stressful to some than others.
Yeah.
Some, it's not stressful at all,
Yeah.
right? They don't feel it in some kind of personal way, and for whatever reason, it's not stressful to them.
Yeah.
Others, there's lots of anxiety associated with it.
That's right.
My wife, for one,
Okay.
she's always thinking about it.
Yeah.
Kids and all that
Sure.
stuff. How do you deal with the stress and the anxiety in the workplace with employees?
Yeah. I'm so glad that you mentioned that this is different for everyone. And so one of my favorite things that I do that looks different now than it did before for sure is talk to employers, employees, healthcare workers about anxiety, stress, fighting burnout, maintaining resilience, finding emotional wellness. And this has taken that to a whole new level, right? People really, really can become quite anxious about different things. But you're right, there are some people who thrive. My husband's an emergency medicine physician.
Yeah.
I mean, bring on the adrenaline.
Right.
That's not an issue for him. For others, being quarantined hasn't been as much of an issue. They sort of like not having all of that input all the time. There are some people who are so social, this is driving them crazy.
That's right.
So I think we have to honor that everyone is going to have a completely different response, and that response is going to evolve over time in different ways. Some may be having financial stressors that are now getting worse. Others may be figuring out new paths for their lives that make them feel better. Maybe they're exercising more. So employers should first of all honor the variety of feelings that they're gonna see with their employees. But I encourage them to talk about it. I encourage them to allow the employees to have some sort of forum, even a virtual Zoom call where they just kind of debrief and share stories and say, gosh, this is really hard on me. I don't know how to homeschool my children. Or, you know what, I'm kind of enjoying the fact that I have time to work out now. But share all of that and honor that and let people talk about it, because if we just decide we're going to go back to business as usual, there's a lot of baggage that people need to unpack right now. And
That's right.
Giving them the space to do that is an important element now of workforce wellness.
That's right. You mentioned a Zoom call. My gosh, I am really tired of Zoom, folks. I
Yeah.
really am. But all of this has pushed telehealth to front and center in the healthcare industry. How are you all at Prisma Health doing telehealth, and how has that risen in terms of its, I guess, popularity with how to do business?
Great question, because before March, the Business Health Solutions Department was already looking at using telehealth as a way to reach more businesses, to provide access to care for more businesses, because not every business can or needs an on-site clinic like the type that we set up. And we were really excited about that, but there was a lot of reticence, right? Well, no, I want to speak to someone in person.
Right.
We're not seeing that anymore, because we've all been indoctrinated by fire to online visits, where we fill in our information and get an email back, telephonic visits, video visits. Many of our primary care all of our primary care physicians are now doing video visits. We are providing video visits. And so people are much more comfortable, and they've realized how incredibly convenient it can be.
That's right.
Now, as a physician, there are many times I would much rather be sitting in
course.
front of someone and be able to listen and lay hands on and talk with somebody. And we're mitigating that. And so for our low-risk situations, we definitely want to see people in person. But it accelerated our efforts in terms of expanding access like no other, because now, in general, more than just our young people are willing to do these kinds of visits.
Exactly.
Yeah.
So sticking with telehealth just for a second, I would imagine that is one of the positive things that might come out of this whole pandemic, is that when all is said and done, people will be comfortable doing business that way as a patient. That's not to say that we're not going to want to go to a doctor from time to time, but is this something you think that from a business perspective will be a positive outcome of what we've been through?
Absolutely. Now that folks are comfortable with the medium, it definitely will increase access and it increase efficiency. So if you're a business that wanted to have care
Right.
available to your employees on site, this is a way to do it.
Right.
It's cost effective, and it really helps the entire healthcare system. If you think about it, over the last few months, one thing we have seen is that those telehealth visit numbers have gone up. The emergency room visits have been appropriate, right? So we've got people in the emergency room who need to be in the emergency room, and people who don't need to be in the emergency room feel like they now have the access that they maybe didn't have before.
I've been to the Prisma Health website several times, and you all are doing a great job there of keeping tons of information on your website. Talk about that website a little and where folks who are interested in getting information can go.
It's a fantastic site. It's very easy to navigate, but has everything you'd want to know on it.
It does.
So you go to prismahealth.org/coronavirus. If you're an employer, there's an area you can click. This is for employers, and it will go through a lot of the questions that we've talked about today and others that have been frequently asked of us, as well as give you information on how to reach out to me and schedule a consultative appointment with me or my team. The other nice thing about that webpage is it's for employees too and community members too. So you don't have to be an employer if you want this information. Anyone can access it. I'll also mention that we have a publicly facing website, benefitsformyworld.com, and there is a COVID wellness toolkit that we've built. This is near and dear to my heart because wellness is really what I'm about, and there are plenty of tools for individuals, businesses, to folks with COVID to access to help with their wellness. And we've got tips, we've got external resources, we have numbers if you're in crisis for psychological care. So lots to be learned from that page as well.
Great information. Doctor, thank you for joining us.
Thank you so much for having me.
Oh, you're
It's been a
welcome.
pleasure.
This was really great. I appreciate you being here. Folks, that concludes another episode of Coping with COVID. If you like this episode, please check out more of them on our YouTube page, and we'll see you next time. Thank you.